Welcome to Module 9, where we will go over some lifestyle issues as they relate to breastfeeding. In this module, we will look at some lifestyle choices and situations that affect your life that you might be wondering about when breastfeeding. There are many topics we will touch on, but we can't possibly cover it all. We will look at dietary considerations, alcohol, smoking and vaping, anxiety and depression, and much more. If you have other questions that we don't cover in this module, be sure to talk with your doctor, midwife, public health nurse, or call 811, the 24-hour nurse line. Many of the foods that you may have avoided during pregnancy are no longer a safety concern after the birth. Unpasteurized cheeses, herbal teas, and sushi, for example, are all fine while breastfeeding. In general, you should have a nutritious diet with lots of variety. You will need about 400 calories more per day while you breastfeed, and that equals to about 2 to 3 extra servings of fruit and vegetables from Canada's Food Guide. You may wish to avoid overly spicy food that you didn't have during your pregnancy, but the spices that you generally enjoy in your diet should be fine. Did you know it is actually beneficial for you to eat your usual flavors and spices while breastfeeding because these flavor your breast milk? Some studies suggest that this can help children accept and enjoy your usual foods and flavors while they are introduced to solids starting at around 6 months of age. Certain seafood that is high in mercury and other toxins should be limited to about 2 servings a week. A general rule of thumb is that the higher up the food chain the fish is, the more toxins they contain. For example, mackerel and pickerel generally have less mercury than large predatory fish like tuna and salmon. Alcohol is another item that enters breast milk and is best to avoid, but more on that later. There are a multitude of different protein and meal replacement drinks available on the market, and they are not all made equal, with some being mostly protein while others are balanced with carbs and fats. Getting your energy from whole foods is a better alternative, but if you are thinking about having protein drinks, be sure to check with your doctor, midwife, or call and ask to speak with the dietitian available on Monday to Friday through 811 before using these products while breastfeeding. Some dietary supplements are marketed specifically to breastfeeding mothers, with some claiming to increase your milk supply. Dietary supplements are not regulated the same way as medications are, and dosages, purity, and even efficacy can vary from pill to pill, dose to dose, and by product. Remember, the best way to increase your milk supply is to move the milk and breastfeed or express often. For more on this, check out our Increasing Your Milk Supply brochure, linked under the resources. Milk cookies and milk teas. Many cultures around the world have used teas and foods to try and increase milk supply. It is not clear from studies if they work, or if they are safe for you and your baby. Remedies such as fenugreek, milk thistle, and blessed thistle are not recommended. Often, mother's milk cookies and teas have these herbs in them, so be sure to check the ingredients in any supplements and discuss these with your doctor, midwife, or pharmacist. Caffeine is the most common stimulant, most often in the form of tea and coffee. Green teas, black teas, matcha, and other teas can all contain caffeine. Most coffees also have caffeine, so check labels if you're looking for products that limit your caffeine intake. There are other sources of caffeine in our diet, such as colas and pop, chocolates and cocoa, and foods made from these ingredients, as well as some medications like allergy and cold medicine. Caffeine does pass into breast milk, but most women can have 1 to 2 cups of tea or coffee per day without affecting their breastfeeding baby. If you have a lot of caffeine-containing foods, your baby might become abnormally wakeful, fussy, or irritable. If this is the case, try reducing or eliminating the caffeine in your diet and see if that helps. Certain over-the-counter and prescription medications also contain stimulants such as ephedrine or caffeine. Sinus decongestants and some antihistamine medications also contain stimulants and can have an impact on your milk supply. It is best to consult with your doctor or pharmacist to make sure that any medication you take is compatible with breastfeeding and won't harm your child. What is known about energy drinks like Red Bull, energy bars, and other energy supplements like ephedrine and caffeine pills? Energy drinks, energy bars, and supplements are not recommended for nursing women as they are a source of caffeine. This can cause irritability and sleep problems with breastfeeding infants if mom consumes more than 300 milligrams of caffeine per day. Energy drinks also often include additives that haven't been proven safe to consume while breastfeeding, especially when taking medications or vitamins that, if mixed together, can cause harm. Energy, beverages, drinks, or shots are not recommended for children, pregnant or nursing women, and persons sensitive to caffeine. There are many other products like ginseng, matcha, and maca that are marketed to increase energy and other claimed benefits, but these have not been scientifically proven, and it is best to avoid these products in any form while you are breastfeeding. You might be wondering about weight loss and supplements that are marketed as weight loss aids. A gradual weight loss of half a kilo or 1 pound per week is safe for breastfeeding moms to return to their pre-pregnancy weight. Breastfeeding mothers have increased energy, carbohydrate, and protein needs. Women who eat less than 1,800 calories a day might reduce the amount of breast milk their bodies make. Weight loss supplements like Garcinia, ALA, HCG, and others are not recommended as they have not been proven to be safe for you or your baby while breastfeeding. The bottom line, there is limited evidence to support the use of herbal products and dietary supplements during breastfeeding. Exercise is a good thing in any stage of life and can help you with your recovery in multiple ways, including to strengthen and have more energy, return to your pre-pregnancy weight and shape, improve your mood and fitness, improve your sleep if not done right before bed, have healthy self-care, strengthen your heart and lungs, and strengthen your bone density. Give yourself time, whether you give birth vaginally or by cesarean section. It takes most women about 6 weeks to return to their normal activities after having a baby. Start exercise slowly, and you can talk with your doctor or midwife at your 6-week checkup about the activities you are unsure of. Light and moderate exercise like walking, hiking, riding a stationary bike, or using an elliptical can often be good places to start. More intensive exercises like running, hot yoga, rollerblading, Zumba, or martial arts are best started once you are well healed from your delivery. For weightlifting, depending on how active you were before you became pregnant, during your pregnancy, and what your fitness goals are, it is best to start with lighter weights and advance slowly with weightlifting and other intensive exercise. Rarely, some babies will notice breast milk taste changes with intensive exercises. If this is the case with your baby, you can breastfeed or pump before exercising, and be sure to always replace the lost fluids after intense physical activity. Most women want to return to their pre-pregnancy weight and shape. Remember that breastfeeding takes about 400 calories a day, so long-term breastfeeding can help you with weight loss. A few key things to remember about exercise in general. Exercise only when you have recovered well and feel ready. Increase your exercise time and intensity slowly and comfortably. If you notice that your baby fusses when feeding after exercising, breastfeed baby first and exercise later. Avoid exercising when it is very hot and humid to reduce the risk for dehydration and heat stroke, and replace fluids lost through sweating and breathing hard. Stop right away if you feel dizzy or lightheaded. Talk with your doctor or midwife if you have concerns or questions about exercise, and especially if you are considering doing high-risk sports. Lifestyle choices can also have an impact on breastfeeding. For example, we know that substances like alcohol, nicotine from cigarettes, and marijuana all enter into breast milk. There is no known safe amount for babies. Alcohol passes into your breast milk in similar amounts as to what is in your bloodstream. It can also decrease milk letdown and could lower the amount of milk your baby gets. Alcohol can affect your baby's feeding, sleep, and weight gain. It is safest to avoid alcohol, but if you want to have a drink on a special occasion, plan ahead. Breastfeed before you drink. Limit the amount to 1 to 2 drinks per occasion. After drinking, wait 2 to 3 hours per drink before breastfeeding or expressing milk for your baby. For guidance on what is considered a drink, be sure to check out the additional information related to alcohol in our resources section. Drinking alcohol can also impair your ability to safely care for your children and other dependents. It's best for the health of you and your baby if you stop smoking. However, your breastfeeding is still important for your baby's health and may even help protect your baby from some of the negative effects of being exposed to tobacco smoke. If you smoke, you can reduce your baby's exposure to secondhand smoke when you smoke outdoors and away from your baby. Wash your hands and change your clothing before you touch or handle your baby. Vaping is not safer than other forms of smoking, so the same precautions and recommendations apply to any product that you might vape as to other forms of smoking. It is safest to avoid marijuana or cannabis. Used during pregnancy, marijuana may be linked to low birth weight, preterm birth, and other complications. THC, also known as tetrahydrocannabinol, is the active ingredient in marijuana that causes the effect of feeling high. THC from cannabis can stay in your system for days to weeks, depending on how much you use, and be passed on to your baby. It is unknown how THC will impact your baby's brain and development long term, and there are concerns that children exposed to marijuana may have long-term behavioral and learning difficulties later on. Talk with your healthcare provider for more information, and be sure to check out our helpful resources for this module for more on the topic. Street drugs such as crack cocaine, meth, heroin, fentanyl, and others are also considered unsafe for breastfeeding and do cross into breast milk. Treatment medications like methadone can be compatible with breastfeeding. For more on this, check out the opiate agonist therapy and substance use in the breastfeeding brochure on our patient education catalog. There is a link to it under the resources section of this module. If your doctor or your midwife is prescribing you medication, be sure to let them know that you are breastfeeding and want to continue. This will help them to make the safest choice in what is ordered. You can also discuss the prescription with your pharmacist, call 811, or a public health nurse. All of these products can affect you and your baby. More information is available in the resource section and from your healthcare provider. Many people are looking to natural products as a lifestyle choice. It is important to know that not all natural products are safe. Many supplements and health food products have not gone through the strict testing and standardization that pharmaceutical agents go through before they make it to store shelves. For this reason, some herbal preparations vary in strength from one dose to the next and from one company to another. We recommend that you discuss any herbal or natural medicines with your doctor or pharmacist before taking them, as they may not be safe with breastfeeding. You can also look for products that have an NPN or natural product number. These products have been deemed safe by Health Canada, but again, not necessarily safe with breastfeeding. Over-the-counter and many prescribed medications can also cross into your breast milk and may affect your baby. Some can impact the flow of your breast milk and even reduce your supply. 811 has pharmacists Monday to Friday during the day hours that you can discuss both over-the-counter and prescription medications with. Homeopathic products like herbal and other natural medications can also cause side effects or interact with other medications. It is best to talk with your doctor or midwife about any of these preparations to make sure they won't harm your baby or affect the flow of your breast milk. You can also look for a homeopathic medicine number or DIN-HM so you know that Health Canada has tested the product and deemed it safe. Remember, just because it has been considered safe does not mean it is safe with breastfeeding. You may be wondering about communicable diseases and whether it is safe to breastfeed your baby. One particular infectious disease that many have questions around is COVID-19. Even if you have COVID, it is recommended that you breastfeed your baby, as your milk will help protect your child from respiratory and other infections. As COVID is a new virus about which we are constantly learning more, be sure to check out fraserhealth.ca for the latest information. Other reliable sources of information are also the BC CDC and Perinatal Services of BC websites that have current up-to-date info on COVID and breastfeeding, such as these examples shown. Parents often ask, should I breastfeed while I am sick? For example, if I have a cold, a sore throat, a fever, the stomach flu, influenza. In general, the answer is yes. Your breast milk contains many antibodies or protective immune factors that can help keep baby from getting sick. When you are unwell, your body makes specific antibodies to fight whatever bacteria or virus is making you sick. By continuing to breastfeed, you can protect your baby from your sickness by giving these antibodies directly to baby, which will act like a shield against getting sick with what you have. It is still important to practice safety measures shown in the previous slide. Wash your hands well and often. Disinfect contact surfaces. Cough or sneeze into a tissue or your elbow rather than your hands. And wear a mask if you are coughing or sneezing a lot during breastfeeding. This will protect your baby from your sneeze and cough droplets. You can also wear a mask to pump if wanting to give baby your breast milk later. This will prevent any droplets from entering the expressed milk. If you have questions about other communicable diseases and breastfeeding, be sure to talk with your doctor, midwife, or public health nurse, because each person's situation is different and it is best to get advice tailored to your specific situation, goals, and needs. Sleep is a basic need. It plays a vital role in all aspects of our lives. As babies generally don't have a set circadian rhythm, the body's internal clock, and because their stomach size is so small, they are often up many times through the night to feed. This is normal, and parents often have unrealistic expectations, hoping that their infant will soon sleep through the night. However, babies need frequent feeds, including night feeds, because of the small amounts they take each time and the importance of building your milk supply. The recommendation is for baby to be breastfeeding 8 or more times per day, and that would include 2 or 3 times during the night. Most adults need about 8 hours of sleep daily for optimal health. For this reason, if you are up during the day and up 2 or 3 times at night, you may get exhausted. When you're tired, your whole health is affected, from your immune system, your coordination, your thinking, and your moods. More on moods later. The trick is to sleep or rest each time baby is sleeping between feeds during the day, as much as possible. It is a good idea to limit visitors for this reason, for your health. If you have other kids in the home, try to sleep when they nap, or have quiet time so at least you can rest for periods during the day. Another option is to ask your family, friends, or other supports to take your older children out so you can have a nap when baby is sleeping. This is a time when many visitors want to help, but without your direction often come to hold the baby. Ask them to help you by spending time with your older kids so that you can get the much needed sleep you need. Even 1 or 2 short naps during the day can refill your sleep needs so you feel better, happier, and more rested. It is generally best to wait until you have healed and feel recovered from your birth experience before starting to have sex again. This may take a little longer if you've had an episiotomy, a cut to your vagina during birth, a perineal tear, or a cesarean section. Another good rule of thumb is to wait until the bleeding stops, which is about 4 to 6 weeks for most women, but each woman's situation is individual and unique to them. Be sure you feel ready and it is not uncomfortable for you. With your newborn's many demands, your physical recovery, and often lack of usual sleep, you may find that sex just isn't a priority for you. Talk with your partner about how you're feeling to make sure you're both on the same page. You may not feel the same way about your breasts as you have before. Find what form of sexual contact you feel comfortable with and discuss it with your partner ahead of time. Your hormone levels during breastfeeding may cause you to have lower than usual sex drive and vaginal dryness. If you have this problem, talk with your partner and be sure to use a water-based vaginal lubricant to make sex more enjoyable. One breastfeeding hormone, oxytocin, can cause contractions of muscles and afterpains with breastfeeding. With an orgasm, you can have a surge of oxytocin which can cause your breast to drip or spray milk. If this is bothering you, you can breastfeed, express, or pump before sex, or wear pads inside a bra. It is completely natural, but often unexpected, so consider talking with your partner ahead of time about this as well. Pregnancy spacing or family planning is likely the last thing on your mind, but timely information on this can truly change the course of your life. Many parents don't know that you can get pregnant right away after the birth of your baby, as soon as you resume sexual activities. You can get pregnant even if you are still bleeding postpartum, and even if you are no longer bleeding, but your periods haven't returned yet. The reason is that you start ovulating or releasing an egg before your periods return. Getting pregnant shortly after having a baby can be a challenge for your body, your emotions, and your family life. For example, you may not return to work long enough to be eligible for another paid maternity leave, affecting your finances. For many different reasons, it is best to consider your goals and plan ahead. There are birth control methods that will have no negative impact on your milk supply. We will look at some of these next. Talk with your doctor or midwife to discuss the best birth control method for you, based on your wish to breastfeed, your family planning needs, and your medical history. So we will look at some of these options next. This chart shows 3 birth control methods that are known to not impact breastfeeding duration or the long-term milk supply. The first one is lactation amenorrhea method, or LAM for short. LAM is 98% effective, but only when all 4 of these conditions are met. Baby must be under 6 months of age, and baby is only breastfeeding, not getting any bottles, infant formula, cereals or other foods, and not using a soother. And mom is breastfeeding every 4 hours during the daytime, and the nighttime feeds are no longer than 6 hours apart. And mom has not had any menstrual periods since giving birth. It is important to note that, like some other birth control methods, LAM does not protect you against sexually transmitted infections or STIs. Back to the chart to look at more options. Copper IUDs, also called IUCs for intrauterine device or contraception, need an invasive procedure for insertion, but they are also about 98% effective and are a good long-term option of birth control. They last about 3 to 10 years, according to the Society of Obstetricians and Gynecologists of Canada. The fertility awareness method requires careful body monitoring, but is an acceptable method for many cultural and religious practices. It's considered a natural family planning method. It is important to note that none of these methods prevent sexually transmitted infections. Here are 3 more options. There are internal and external condoms, which act as a physical barrier preventing sperm from reaching the egg. Condoms can prevent STIs and won't impact your milk supply. Hormonal IUDs or IUCs, birth control patches, and shots can all affect your milk supply. So if this is a concern for you, choose one of the other options. Hormonal IUDs release hormones into your body over time, tricking it into believing you are pregnant. They are good long-term options if you are not concerned about your milk supply, lasting about 3 to 5 years, and are about 99% effective. Your doctor may refer to this type of birth control as LARC, or long-acting reversible contraceptive. Both copper and hormonal IUDs are a form of LARC. Birth control pills require careful dosing every single day, optimally the same time each day to be the most effective. Birth control pills are hormone pills that make your body think you are pregnant. These pills can affect your milk supply. They do not prevent STIs, and they're about 93% effective. There are many other options, and you can learn about the pros and cons of each to find what will work best for you. Visit the websites under resources of this module for more information on birth control options. Talk to your obstetrician or family doctor to discuss what option might be best for you based on your needs and your medical history. It is important to know that most women, up to 80%, experience baby blues in the first days after having a baby. You may find yourself feeling teary, very tired, sad, helpless, or irritable. These feelings can be caused by a drop in your hormone levels after birth and a lack of sleep with caring for your new baby. Generally, these feelings are short-lived and go away within 1 to 2 weeks. However, some women find these feelings lasting longer or are more intense, so it is good to pay attention to the symptoms of depression and anxiety because more than 1 in 5 women will have some depression or anxiety in the time from pregnancy to the months after baby is born. In Fraser Health, there is a program called Best Beginnings to support you if you find that you are feeling depressed or anxious in pregnancy or after having your baby. We encourage you to fill out our Best Beginnings prenatal registration form to access this program in your pregnancy for each of your pregnancies. A public health nurse may call you if you have indicated on your prenatal registration that you are feeling sad. A nurse will also call you when you come home from the hospital with your baby and check in with you about how you and your baby are doing. Talk to your nurse about how you are feeling emotionally so she can support you and link you with helpful resources. Signs of depression and anxiety include feeling sad and anxious much of the time or crying a lot, feeling guilty, worthless or hopeless, or scared, finding it hard to focus or concentrate, having trouble sleeping and feeling low on energy, not wanting to spend time with family or friends and not enjoying life like you did before, not enjoying time with your baby. It's important to know that it's not your fault. It happens to 1 in 5 women, so it's very common. It's important to talk to someone about your feelings so you can find help. Help is available. There is a 24-hour crisis line for Fraser Health. Research tells us that breastfeeding is a protective factor against depression. That is, it increases a woman's sense of feeling good about herself, confidence in herself as a mother, and enjoyment in that role. However, if breastfeeding is a struggle or painful, it can have a negative effect on a mother's emotions. That is why it is so important to get help with breastfeeding, but also to get help for the feelings of depression and anxiety. With breastfeeding support and also support for emotional health, successful breastfeeding can help mom feel better sooner. In addition to the crisis line mentioned earlier, there are other ways to get help for depression and anxiety. Talk with your doctor, midwife, or public health nurse. Call 811, where you can speak with a nurse about how you're feeling and receive confidential information and advice 24 hours a day, 7 days a week. The Pacific Postpartum Support Society is available for phone and text support. Check out their website for contact information. You can call Fraser Health Mental Health Services and ask for a counselor to speak with. The website Here to Help has a lot of helpful information and stories from parents when you search postpartum depression. You will find links to these resources in the resource section of this module. Sometimes it is important to have help right away. If at any time you have thoughts or plans to harm yourself or your baby, you will need to speak with a doctor right away or call 911 to have an urgent assessment done in the emergency department. Weaning a baby from breastfeeding to drinking from a cup is a big change, both for mom and baby. For moms, it is a change both physically and often emotionally too. When is the best time to wean? There is no right or wrong time. Continued breastfeeding is recommended for up to 2 years and beyond, but your decision will depend on when you and your baby are ready to wean. It helps to start when no other major changes are going on in your family, and your baby may need some extra comfort and cuddles during the weaning process. How? It is best for both mums and babies when weaning is done gradually. You can start by replacing one daily feeding every 5 to 7 days. This way, your baby will have time to adjust to new ways of feeding and make it easier for your breast to adjust milk production without becoming too full and sore. There is more helpful information on weaning in Toddler's First Steps available online and linked in the resource sections of this module. If you have any questions, be sure to talk to your doctor, midwife, nurse practitioner, call 811 24 hours a day, 7 days a week, or your public health nurse for support. You will find a lot of additional information on these topics in this module. Be sure to check out these resources under the video for this module. Thank you for your interest in the topics that we have discussed. Remember to return to any of these modules as questions come up for you in the future. All the best in your journey.